www.healthcmi.com, Acupuncture Continuing Education Online. Today, acupuncture for the treatment of cardiac arrhythmias. This came up at the news department at healthcmi.com, Acupuncture Continuing Education Online, October 30th, 2017. We published an article. If you go to healthcmi.com and click on Acupuncture and Herbs Regulate Cardiac Arrhythmias, you can see a very interesting article. Hunan Hengyang Traditional Chinese Medicine Hospital researchers find acupuncture combined with herbal medicine more effective than calcium channel blockers and beta blockers for the treatment of cardiac arrhythmias. Results were confirmed with electrocardiograms. Patients receiving only pharmaceutical medications in one group and acupuncture plus herbs in another group were compared. So again, you had a drug group, standard calcium channel blockers and beta blockers, compared with the group receiving acupuncture plus herbal medicine, traditional Chinese medicine. And it turns out that the acupuncture plus herbs group outperformed the drug group. So that was confirmed with the 24-hour electrocardiogram results. And also, general outcomes were also measured for things like chest discomfort, heart palpitations, shortness of breath, fatigue, and limb weakness. So this article literally covers two separate pieces of research, very important. And what we're seeing here is a fundamental shift. What's happened is we've come to think of the drugs as the most effective means of getting the job done. In other words, it may not be the safest because there's adverse effects associated with drugs, but ultimately we've come to think in terms of consensually validated reality that the drugs are the most responsible way to get the job done. But we're finding out that sometimes drugs aren't as effective. So there's a bias in commonly accepted conventional wisdom that drugs are more potent and effective than holistic therapy, such as acupuncture and herbal medicine. But the electrocardiogram numbers indicate that acupuncture plus herbs is significantly more effective for the regulation of arrhythmias than medications, bucking the myth that drugs are somehow a more bona fide and successful treatment option. Now, is this true across all types of arrhythmias? Certainly in the case of atrial fibrillation, and we've covered this topic before, acupuncture may be a superior treatment option. And we see this in other forms of research at healthcmi.com. If we go to the research published at healthcmi.com on June 9th, 2017, in an article entitled Acupuncture Reverts Heart Arrhythmias to Normal, again, go to news at healthcmi.com. So you click on that news tab and you'll find that article, June 9, 2017. Easy to leaf through all the articles if you click on the View All News link to the articles, which is at the top of every page once you click on news. And that article features University of Minnesota in Minneapolis research finding acupuncture effective for the treatment of cardiac arrhythmias. In a meta-analysis of 8 independent investigations, acupuncture had an 87 to 100% success rate for converting patients to a normal sinus rhythm after acupuncture. I'm literally quoting the research quote, normal sinus rhythm after acupuncture. Based on the findings, the University of Minnesota researchers recommend additional studies, including those with long-term follow-up examinations. So in that case, it was atrial fibrillation. In the prior article we mentioned, it was also including ventricular issues, so PVCs. So we have a lot of research coming out. And what's nice for licensed acupuncturists is these articles give you the exact acupuncture points and the exact herbs that are getting the job done. In the second article from the University of Minnesota for the atrial fibrillation, a specific type of arrhythmia, they're recommending points such as PC6, Heart7, and CV17, Neiguan, Shenmen, Dongzheng. And of course, that influences the research at healthcmi.com and the educational material we put out. So our up-and-coming course on the treatment of hypertension and arrhythmias feature this research. So what we're doing is we're taking the ancient prescriptions and then comparing it with the modern research, testing those ancient prescriptions, and then formulating a codified treatment prescription, acupuncture point prescription, based on both ancient recommendations and modern science. That's how we get the job done, because the view in Chinese medicine is that there is no Eastern and Western, there's no Northern and Southern, there's no bad or good medicine, there's only appropriate medicine. What is appropriate medicine? Appropriate medicine is safe and effective. So what we're trying to do is sift through the history of Chinese medicine, looking at those favored acupuncture point prescription protocols by different masters throughout the centuries, comparing that with the modern research using the scientific method, and seeing what holds up the test of time in a long continuum of all medicine. Keeping in mind that so many of the acupuncturists, especially in China, are what we call MDs. This is their specialty. Keeping in mind that, again, there is no good and bad medicine, there is only safe and effective medicine, we're looking to find out what gets the job done. And let me be very, very specific. If someone has, for example, atrial fibrillation, this is a very serious condition. This can lead to blood clots, which can lead to strokes and heart attacks. If there is cardioversion, in other words, the heartbeat is returned to a normal rhythm, so that would be a normal sinus rhythm, there is less chance of clotting and therefore stroke and heart attack. If we return the heart to a normal heartbeat, we also have better energy, less exhaustion, able to climb stairs better, and a feeling of well-being. So there is decreased risk of a calamity, and there's an increased quality of life. So how do we get that done in a biomedicine conventional way? Well, one is something like amiodarone, a very dangerous and risky drug. One of the main side effects of it is cystic fibrosis, sometimes massive hallucinations, and it doesn't always work. And unfortunately, for some people, it may be the only treatment option in some cases. Heart ablation surgery, burning different parts of the heart so that the signals are changed such that the heart goes back in the normal sinus rhythm, so that is heart surgery. Or how about knocking someone unconscious, stopping their heart and defibrillating them, paddling them back to reset the sinus rhythm? These options, while they can be effective and sometimes only effective for a short period of time, are not without complications. But they all achieve something called cardioversion, getting the sinus rhythm back to normal. However, acupuncture cardioversion also works. We can return the sinus rhythm. And without really serious side effects, acupuncture can cause a little discomfort at times, or it can be very comfortable, or it might cause minor bruising typically. And that's about it. And in most cases, it doesn't cause bruising. Most people are amazed that when you remove an acupuncture needle, it doesn't bleed. In 95% of the cases, there's not even a drop of blood. And by bleeding, I mean 1 drop of blood. Acupuncture is applied to very special areas, so there is no bleeding. So the concerns for discomfort are real, but overall, most people feel comfortable with acupuncture. But the point is that it gets cardioversion accomplished. This is very serious business. And we test these points, and we find out that points like PC6 combined with PC7, combined with Heart 7 and Heart 5, and CV17 with Du20 or Shenseng, that's the combination. We put this in our educational materials for continuing education online at healthcmi.com. Pretty much will revert the patient. And the acupuncturist, of course, will customize, adding liver 3 for qi stagnation and such and so forth. Stomach 36 for qi deficiency. There are some specialized customizations that are required for each patient based on differential diagnostics. Nonetheless, that's what we do here at the Healthcare Medicine Institute at healthcmi.com. We look at this research, we translate it from the Chinese research or the Japanese or Korean research, and we also do the work here in America, republishing a lot of the work that comes out of our major universities. In this second article, we mentioned from the University of Minnesota from June 9th, acupuncture reverts heart arrhythmias to normal. And in our first article that we went over from October 30th, 2017, acupuncture and herbs regulate cardiac arrhythmias. If you want to take a look, go ahead. Visit healthcmi.com. I think you'll be happy to see that there's something for the layperson to learn about the benefits of acupuncture and herbal medicine, and something for the licensed acupuncturist to have a serious look at protocols and what to do in the case of needing to achieve cardioversion. I'm Adam White, licensed acupuncturist. Thank you for listening. www.healthcmi.com.